For today's lecture, we're focusing on place, neighborhood, and overall ecological context in terms of their influence on health behaviors that are shown to be associated with various physical and mental health benefits, and how the physical environment affect these behaviors. We're focusing primarily on physical activity and healthy diet. And the reasons we are focusing on them because these behaviors are associated with so many health-related issues when folks are not physically active or are not eating a healthy diet. CDC report using data from 2007 to 2020 shows about 25.3% of the U.S. population are not physically active, meaning that they are not meeting recommended guidelines for 150 minutes of moderate to vigorous level of physical activity a week. Another CDC report shows that about 41.9% of U.S. adults are obese, and this is a BMI of body mass index of 30 or higher. 9.2% of U.S. adults are in the severely obese category, and this is a BMI of 40 or higher. Physical inactivity and obesity impact various mechanisms, biological and psychological mechanisms that are associated with cardiovascular diseases, therefore cardiovascular health, including inflammation, stress response, and immune response. Diet impact various hormonal processes that in turn impact how certain systems in our bodies are work. As we've talked about before, physical activity impact the release of various neurotransmitters that are associated with psychological stress and psychological health. Serotonin, for example, dopamine are examples of these neurotransmitters that are associated with psychological health that are impacted by physical activity. So clearly, physical inactivity hinders, can have an adverse impact on various biological mechanisms that are associated with physical health and mental health. Accordingly, interventions that target the initiation and maintenance of physical activity and diet are important public health concerns because, as I've mentioned before, chronic physical inactivity, not meeting recommended guidelines for physical activity, not eating a healthy diet over time are associated with so many chronic conditions. And these are some of the chronic conditions below. For example, regular physical activity protect from risk for these conditions: hypertension, cardiovascular diseases, type 2 diabetes, and certain cancers. Psychological benefits associated with exercising regularly include better mood, improved memory, decreased symptoms of depression and anxiety. I use the term physical activity and exercise interchangeably. Within the research area, physical activity is any engagement where you're increasing your heart rate, and that activity can be done. It doesn't have to be a standard way of exercising. It can be, playing basketball game. It could be that gardening where you're moving and increasing your heart rate. So any physical activity where you're moving, increasing your heart rate is considered physical activity, where exercise is more of a standard scheduled type of behaviors, going to the gym, completing an exercise class. So these are there's some nuances between those two, but in the literature at times they're used interchangeably in some studies. As mentioned, intervention aimed at increasing physical activity and healthy diet are important public health research areas. A lot of these interventions have looked at change at the individual level. We seek to help population increase their physical activity and eat healthy, looking at various facilitators of these behaviors at the individual level. One of the models that has been used to inform intervention targeting these two behaviors is the trans-theoretical model of behavior change. These models include 4 different constructs that are interactive in terms of explaining behavior and behavior change. The first one is stage of change, which you may have heard of. Stage of change really underline various intentions to change a behavior, to change or not to change a behavior, within a certain timeline. The stage of change are pre-contemplation, contemplation, preparation, action, and maintenance. So someone who's in the pre-contemplation, meaning that not really thinking about changing their physical activity or healthy diet, are likely to report higher cons for engaging in the behavior. So decisional balance, we outweigh the pros and cons for engaging or not engaging in the behavior. As you can see, these 2 constructs are bidirectional, which means they influence one another. So conversely, if you are in a preparation stage, which means you are preparing to change very soon, let's say within the next 30 days, preparing to engage in physical activity, to start eating healthy, you are expected to have lower cons for that behavior. Over here is self-efficacy. Self-efficacy is our perceived ability to change or perceived ability to engage in the target behavior or behaviors when faced with various situations. For example, your ability to engage in exercise when you have limited time or when you're feeling fatigued, whatever the hurdle might be. So it's your perceived ability to overcome that barrier. Down here is processes of change. Processes of change include experiential processes or behavior processes that we engage in, people engage in as they go about changing their behavior. Like, for example, one of the processes is called consciousness raising. So when we start to change our behavior, we tend to seek information about the behavior. So increasing your understanding about how the biological and psychological impact, how diet and physical activity impact, various biological mechanisms that are associated with cardiovascular health. Seeking that information is an example of consciousness raising, which we tend to do when we're trying to engage in a behavior to learn more about it. These are the 10 processes, various processes that we go through. All of these construct interact to impact change. For example, if where you are here impact where you are here. So if you're in early stage of change in pre-contemplation, your self-efficacy to engage in the behavior is going to be really low. Accordingly, you're using less processes to engage in the behavior. So if you're not really thinking about changing, you're not really going to engage in information seeking about the behavior, or you're not really going to use various strategies to engage in the behavior, like changing your environment, making it more suitable to engage in physical activity or eating healthy. So environmental reevaluation is another processes of change. Why is this important to know this? Because it is essential as we think about methodological approaches and changing, targeting health disparities, that we are aware of the various models within public health that have been used to inform intervention or programs targeting various health behaviors. So as I just mentioned, a lot of intervention approaches primarily look at individual level factors. But we know based on the readings that you've done for this module, and of course probably before, and based on the discussion boards I have read, that there's a great understanding. You guys have a great understanding in terms of where you live, where you interact, where really places where you spend most of your time, how they can either help to promote health, or therefore serving as a facilitator to health and mental health, or serve as barriers for you to engage in healthy behaviors. So attributes of your physical environment have shown to be associated with increased risk for cardiovascular diseases. And we know chronic physical inactivity and diet poor diet are risk factors for cardiovascular diseases. So neighborhood features, as we see, are impacted based on the readings for this module, are impacted by socioeconomic status. By now, you're seeing that various social determinants of health are very highly correlated. So the physical environment, your place of residence, where you spend your time recreationally, are impacted by socioeconomic factors. So the attributes of the physical environment are impacted by the socioeconomic of the residents of that neighborhood. Or, the large portion, if the large portion of the residents are low income, that's going to be impacted in terms of the features that you see within that neighborhood. And we know that race and ethnicity are associated with income because, for example, African Americans and Latinos, for example, do structural racism and systemic oppression tend to be of low income. Accordingly, they tend to live in a neighborhood wherein the physical environment is very much different than their white, higher income white counterparts. Based on the fact that we know that the physical environment impact change. So it's not just at the individual level. Individual level factors are important, but regardless of our intention to change, let's say that based on the trans-theoretical model of behavior change, you see that members of a population are really want to change their behavior. They indicate, they're in the preparation to change. They want to change. So this is really preparation. This is a really good stage indicating that you're more likely to change because you're getting ready to change your behavior. Or in action, you're actually starting to change your behavior, and they report. But regardless of that intention, right, the physical environment can be a con that influences over time, that impacted one's intention to change, right? Because remember, I probably didn't mention before, stage of change are not linear, which means you started a stage of change and you increasing. You can actually revert back to early stage of change, meaning someone who was preparing to change based on various cons over time can go back to an earlier stage of change and not changing their behavior. So the ecological model really is important in understanding the built environment, because it's saying that we can't just look at primarily change at the individual level, given that various factors, because the individual residents of a community, members of a population are embedded within various systems that interact to impact their physical environment, their lifestyle, the choices that they made, their intention to change, their perceived self-efficacy to change. So the ecological model is saying that individual thinking about behavior and behavior change, center has to be these various systems that work to impact change, including the physical environment. So According to CDC, there are various neighborhood indicators that influence health behaviors, including physical activity and healthy diet. Green spaces, food environment, social cohesion, even incarceration. So these are some examples of indicators of neighborhood features or characteristic of a neighborhood that have shown to have really high impact, significantly impact health and mental health, and in terms of health, including physical activity and healthy diet. The physical environment, green spaces, walking trails, parks, parked with certain amenities. And as I mentioned, incarceration, the disruption within the family. So if you have a neighborhood where there's a high level of incarceration, that disrupt the family, that impact poverty, and poverty has shown to impact healthy engagement and behaviors. Meaning that people who are typically significantly low income tend to be grossly under physically active and tend to really not engaging in a healthy diet. So conversely, certain neighborhood features are associated with healthy behaviors, including physical activity and diet. So walkability of sidewalk, walkability. So availability of sidewalk, availability of parks that I mentioned, park amenities. So parks that has basketball court, that has tennis courts, that has water fountains, that have greeneries, green spaces, walking trails, are really essential amenities that have shown to really impact engagement and healthy behaviors. Neighborhood safety, food environment. So neighborhood safety, rates of crime, lighting within the neighborhood, because there's certain neighborhood where lighting is pretty poor. And so neighborhood safety can be assessed different ways, prevalence of crime rates, but also, how properly lit is the neighborhood. If you live in Long Island, unfortunately, you hear in the news all the time, pedestrians are being killed because some of the neighborhoods within Long Island are pretty poorly lit. They're pretty poorly lit. So that may be a barrier for physical activity if you have poor lighting. So if more light, increase engagement in physical activity. Food environment also impact engagement in healthy behaviors, how you eat and what you eat. So several studies have shown that neighborhoods that have walkable parks, availability of parks and green spaces, that residents among those communities are more likely to be meeting recommended guidelines of moderate to vigorous level of physical activity. And this level of exercising has shown to be beneficial to health and mental health. Not that any type of exercise, any type of physical activity where you're moving your body is important for health and mental health. However, engaging in exercise at this level over time has shown to be very protective for various physical and mental health conditions. Similarly, neighborhoods that have these amenities the residents tend to report better psychological health. In terms of eating behaviors, in terms of diet, food environments, availability of foods, more groceries and farmers market within a neighborhood, within an area, show less risk for obesity in the residents. So it makes sense that availability of healthy choices, of healthy foods influence the food choice that you make, and over time your dietary patterns. All of us, if you go into a neighborhood and you are being bombarded by fried food joints, over time you're more likely to give in, right? Especially the smell of some fried foods, regardless of your intention to change, but the physical environment may impact uh, your choices of food. But also, availability of foods, also affordability of foods also impact the choice that you make. Also, is density of liquor stores associated within neighborhood is a various it's a problematic health problems, because if you're consuming a lot of alcohol, your likelihood of making better food choices very low, because lower inhibition. So even though you were intending to eat healthy, consuming a lot of alcohol and eating in unhealthy eating that could impact physical activity and healthy eating patterns as well. So having low density, low density of available liquor stores within a neighborhood not only is a protective factors of alcohol misuse, but also can be associated with other healthy behaviors engagement. As I mentioned earlier, that socioeconomic factors impact features the characteristic of the built environment. So some of these socioeconomic related factors are income level of education and employment. And we see that these are interactive. If you have higher level of education, you tend to have higher income. There are people who are not highly educated or don't have advanced degrees tend to have higher income. But the reality is, on average, your income is based on your level of education. Of course, make sure, and of course, employment inform your income level, and your employment is also informed by your level of education. So inequities in terms of differences in the physical environment, we see a lot of inequities among racial and ethnic groups. Not only the research shows that you can have physical environments that are very close in proximity, but yet are vastly different in terms of features and amenities. One of these environments, I was traveling a few years ago. I was in Florida, and I forgot where I was visiting, exactly where that community, that environment is. Probably wouldn't have said it anyway, just in case you live in it. I don't want to offend anybody. So my husband and I, we were walking in a neighborhood that clearly it was by the water. It looks like it's pretty high affluence in terms of the income level of the resident. Very beautiful, very nice and tranquil. And we just proceeded to walk over a bridge. There is a bridge, and that bridge goes into another neighborhood. The stark difference of neighborhood features. That other neighborhoods, those two neighborhoods only separated by a bridge. Walking up and crossing the bridge, dilapidated infrastructures, trash in the streets. The dilapidated infrastructures include just parks that look like very, poorly maintained. So playgrounds that look like it hadn't been cleaned for a while. And unfortunately, there are even needles at the playground. So you can have neighborhoods that are pretty close in proximity, and yet be vastly different. And what is driving that is the income level of the neighborhood. So low-income neighborhoods tend to have less walkable parks. If you walk into certain low-income neighborhoods, unfortunately, trees or bushes are overgrown, impacting access to the sidewalk. And I think that's one of the reasons to why we see a lot of vehicular accidents, because people are not walking on the sidewalks because they can access it at times. That probably plays a role in why we're seeing a lot of these vehicular deaths. yes, it can be pretty sad to look at the physical features of a neighborhood. Looks like I was also somewhere in New Jersey and really saw how depressing going into physically walking into that neighborhood, even though I was just stopping there for a while, for just a brief moment, how depressing it is, seeing people on the streets, laying on the streets, and just the level of poverty surrounding, really thick in the air, is unfortunate, given in the country we're living in. So, as I mentioned, when parks are available in low-income neighborhood, they're not well maintained. So, accordingly, you're not likely to go to the park and engage in exercise because parks have, as I mentioned, the availability of parks are associated with increased engagement in physical activity. But these are parks that are well maintained, that have really great amenities, such as greeneries, water fountains, basketball court, tennis court, different courts, and also different programs. So, and also the communities that have really subpar features tend to really be low on community cohesion. Think about the physical space, parks, walking trails can facilitate engagement among residents because folks are using these environments to engage in exercise and therefore more likely to interact with one another. Another problem that we see within public health is that not only that these neighborhoods have dilapidated parks, neighborhoods that have large portion of racial minorities, but also they have less park space in comparison to high income neighborhoods. And this is problematic. Why this is problematic? Because if you're low income, you're less likely to afford a gym membership, for example, to engage in physical activity. So the community resources like parks and walking trails are pretty essential for increasing the likelihood of people engaging in physical activity. But we see that there is absolutely a difference in inequities in terms of availability of parks. Like, for example, NYC neighborhood have 21% less park space in comparison to their high income counterparts. And we see that several researchers established that low income communities tend to be less physically active in comparison to their high income neighborhoods. And availability of parks, in addition to quality of parks, have influential affect these behaviors, at least contribute in part to these to chronic physical inactivity. Similarly, we see that because in poor neighborhoods, there tend to be food swamp or food shortage, a healthy food shortage. So food swamps, as explained in one of your articles, the module 7, is the high rate of, let's say, unhealthy foods that are available within the community. So in a comparison to groceries that provide healthy foods, you're more likely to have convenience stores. You're more likely to have fried food restaurants that provide unhealthy options. So there's low access among residents, low access to healthy foods among residents of low-income neighborhoods, unfortunately. And what we see that in turn impact daily fruits and vegetables, and we see the residents of those neighborhoods seem to have high consumption of food, unhealthy food like saturated fat and refined sugar. And of course, healthy eating behaviors, what you eat impact your BMI, and of course increase your risk for obesity. And I had mentioned earlier that dietary intake, what you eat, the quality of food you eat, really have various biological and psychological impact, like inflammation, stress response, and immune response, are impacted by also your diet. So recommendation for increasing physical activity is, as I mentioned, essential public health essential area within public health. As a physical activity researcher focusing primarily on African American populations, we see how engagement in physical activity can have acute positive impact on mental health and physical health. Even like a short bout of 10 minutes of physical activity can can improve people's mood, can help decrease physical fatigue. So these are behaviors that we essentially want to work in increasing among population for whom chronic conditioning associated with lack of physical activity is highly prevalent. So recommendations for increasing physical activity, as I mentioned, is important public health, macro level type of approaches, including federal level approaches toward increasing physical activity, centers around providing funds to support, renovating parks, and then also including more green spaces within various neighborhoods. Park renovation is there are several also state level grants that are available for that, landmark water conservation funds and community parks initiatives, increasing green spaces in low income neighborhoods. That's one of their aims. There are a lot of that's been going on in New York City, and I was part of a study that compared 20 parks that had been renovated to parks that had not been renovated, and looked at one of the things it looked at is physical activity changes over time among these different neighborhoods. And park renovation was associated with an increased level of physical activity and social cohesion in that study I just mentioned. So other recommendation for increasing physical activity is, of course, developing behavioral health intervention that help to maintain physical activity. Behavioral health intervention, including clinical trials that look at different treatments that target barriers as well as facilitate the physical activity in the particular populations. And where we are in terms public health intervention for PA is that there are a lot of work that have been done, and a lot of the work have targeted low income and minority populations, given the disparity in physical activity and that is very much prevalent among this population. But in increasing physical activity have been overall effective in terms of helping people to start exercising. But maintaining this behavior long term, which is really associated with various long-term health benefits, continue to be something that we are continuously working on. And part of the recommendations that really address the physical environment in which people live is when we cannot intervene at changing the environment, because when you're doing a behavioral health clinical trials, right, you really do not have the funding to change people's environment. Most physical activity interventions take a lot of money to develop and implement. And it may be that you are part of addressing the physical environment might be strategies looking at alternative environments that will serve opportunities for your participant to engage in physical activity, like their workplace. There's been several work that look at workplace as potential, the surrounding areas within the workplace that could give potential opportunities to engage in physical activity. Several studies have that use short text messages as a reminder for people to engage exercise. Will take account of people's schedule. So when they are working, they get reminders to engage in physical activity by using geolocation and saying, well, based on where you are, the park is like 10 minutes away or 5 minutes away. Why don't you grab your lunch and walk to the park? And being in an environment and a green place, and also serving as an opportunity to increase your step counts or your minutes of physical activity. Churches, malls, adjacent neighborhoods, other neighborhoods that are close in proximity that have better amenities are some of the ways in which we have intervened, seek to address the physical environment in terms of engaging in physical activity. Wii games and apps are other alternative approaches where you really do not have alternative environments. So you can't intervene based on information you have around the workplace or the church or malls. And by malls, I mean, there are a lot of intervention that have partnered with malls, because certain malls used to have walking hours. Growing up, I would see older ladies just walking around the mall at a certain time. So certain malls have walking hours. I do not know if they still have that, but that's one of the ways in which public health intervention have tried to overcome environmental level barriers in terms of physical activity engagement, is by sharing information about walking hours. Wii games and apps are alternative approaches for increasing physical activity. Engaging in various Wii games really can provide opportunities to really increase your level of physical activity. Even moderate level of exercise. Apps also provide another opportunity to engage in physical activity. So one of the grants, that application I was part of, was partnering with Peloton to provide purchasing membership for participants to provide access to physical activity. So the Peloton app, which is not well advertised, provide users with various physical activities, from aerobics to strength exercise to yoga and all of that. So, and some of these exercises do not require exercise equipment, and they do not require large spaces to engage in physical activity. accordingly, behavioral health intervention to effectively promote physical activity and healthy behaviors have to look at both changes at the individual level as well as the various system levels, the policy, physical environment, and social environment, because it really gives a better understanding of how various factors work to impact the target behavior for this particular population, and accordingly help us to understand what are some strategies that we have to leverage to help address important barriers. For example, intervening at the physical environment in terms of physical activity, providing identifying alternative environments for physical activities. One way we can intervene at the physical level, as well as increasing access to food, partnering with farmers market so that they're able to have more frequent farmers market in these neighborhoods where access to healthy foods is pretty sparse. But nevertheless, individual level factors are really important as well. Interpersonal factors are really important as well, because we can find there are studies where environmental factors are not problematic, high SES, yet among these subgroups we find there is high obesity, there is chronic physical inactivity. And so while your self-efficacy, your intention to change might be impacted by the physical environment, right? Because it's a hurdle despite your intention to change. And therefore, your decision to change, the high cons you report might also be part of the physical environment. So the physical environment to exercise, lack of walkable sidewalks, lack of parks might be some of the cons for physical activity. Similarly, lack of access to healthy food might be a cons for a healthy diet, despite your intention to want to eat healthy and exercise. But even as I mentioned, when these things are not hindrances, they're not relevant barriers, we still see chronic physical inactivity and a healthy diet and therefore high obesity rates among some high SES populations. But even when these factors are removed, are evident are intervened on for low-income neighborhoods, we still need to include individual level construct of behavior change, because I can intervene and provide an alternative environment and tell you exactly where this is and use geolocation and send you the driving instruction and send reminders to you based on your availability, your work schedule. But if you're not motivated, I still need to intervene at the interpersonal level as well. So looking at self-efficacy, how it might be influenced by the physical environment, but also look at self-efficacy, how it might be influenced by individual characteristic. Okay. All right. So recap. We know the built environment is an important social determinant of health because it influences engagement in so many health behaviors. So neighborhood characteristics accordingly help maintain disparities in certain behaviors, particularly in health and dietary and physical activity and dietary behaviors. Intervention that address the built environment are necessary because, despite, as I mentioned, people's intention to change, the physical environment might be an important barrier in terms of access. However, in addition to addressing the physical environment or thinking about making the physical environment an important part of intervention, not just say that the physical environment might hinder physical activity, but addressing it in terms of providing strategies of how to overcome it. We also have to look at change at the individual level, meaning that thinking about how self-efficacy can be, self-efficacy motivation to exercise can really be impacted by interpersonal factors, individual level factors is really essential. So here are some references on the topic, and I will see you in the next module. Bye.